We've got your Father's Day gift at Macy's Backstage. The brands and styles he loves at prices so low you never need a coupon, ever. With a huge assortment of gifts just $14.99 and under, you never know what you'll find, but you'll always find something. Shirts, shorts, suits, ties, shoes, watches, grooming gifts, barbecue gear, and great home trends. And when you find it, get it. It's here today, gone tomorrow, with new items arriving every week. We're all about great gifts for Dad. Visit Macy'sBackstage.com for locations.
Blog Talk Radio.
Welcome to Partners in Health and Biz with your host, Gail Dixon. Tune in every Saturday, 9 a.m. for great shows about obtaining and maintaining health, business, and finance. Learn from the experts.
Welcome to Partners in Health and Biz with your host, Wendy Meyeroff. Tune in every Saturday, 9 a.m. for great shows about obtaining and maintaining health, business, and finance. Learn from the experts here at PIHradio.net. Call into the studio with your questions and comments, 347-945-7433. And now, broadcasting from the Partners in Health and Biz studio, here's Wendy.
Hi, folks. It is indeed Wendy Meyeroff. Gail is so popular that sometimes, apparently, her intro comes on first. But Gail Dixon is indeed the founder and the co-host of Partners in Health and Biz every Saturday morning. But today it's me, Wendy Meyeroff, and I am here with an amazing guest, Linda Fisher, who is Vice President of Product Strategy for DrFirst, which is based in Rockville, Maryland, and we'll tell you a little bit more about this in a second. But let me tell you about what the show is today, and it's got to do with addictions, especially opioids, but we don't ignore the rest of them. The overall addiction here in Maryland on July 1st, the prescribers statewide will need to check the state's prescription drug monitoring program database before prescribing controlled substances. So hooray for Maryland. And we're going to talk about technology. You can call in today, but this is not a crisis helpline, folks. This is a talk show, and we're talking about opioids and the health technology today that's going to help, whether it's mobile apps or whatever. Linda Fisher is going to tell us more about it in a second. The call-in for guests is 347-945-7433, and I've given that number to Linda Fisher. So, Linda, welcome on board. You are Vice President of Product Strategy for the Rockville-based DrFirst, yes?
Yes, and good morning. Yes, but I'm also a retired CIO of 22 years from a hospital.
Oh, Lord, God bless you. Well, I understand the other thing. DrFirst is the leading provider of e-prescribing and patient medication management solutions, and you have taken a very prominent role in the national fight against opioid addiction, which includes a member of the opioid task force of what's called the College of Healthcare Information Management Executives, which we call, as an abbreviation, CHIME. And CHIME is advocating for the federal government to become more involved in dealing with this crisis, the opioid crisis, and I'm sure addiction in general, right?
Exactly, and they're working on both the state and federal level, and they're following all the regulations and bills that are before Congress and the Senate.
Yeah, I understand that the gap, I pulled something off online. It's from a group called the Scattergood Foundation, and according to their 2017 America's Opioid Epidemic, it noted that even with Obamacare, and we know how Obamacare is being trounced right now, but it said, and I quote, "The gap between the need for treatment and the number of people served is huge. In addition, existing coverage is in peril if states are permitted to choose what Medicaid services to cover. And if Medicaid is lost to over 20 million Americans, including an estimated 2 million with substance use disorders." So, substance use disorders, I end the quote. It's scary. So why hasn't this been resolved yet. We've been talking about a lack of collaboration. What is happening? Very briefly, Linda, because we want to talk about DrFirst, but give us a little bit of background on the opioid issue.
Well, I think one of the major issues and why it hasn't been identified quicker than it should have been is because the substance abuse patient didn't fit the mold of what the physician thought an addicted person was. And for the patient, the stigma that was attached to becoming addicted to these opioids was so great that they didn't seek help. So for a long time, it went on with everybody pretending there was no issue.
And you just told me an interesting story about a doctor, and I think it was a parent who was like 83. Tell the audience that very quick note you just gave me a couple of minutes ago.
Yes, I was a guest speaker at an opioid symposium along with this physician whose 83-year-old father went in for knee surgery and became addicted to the opioids. Go ahead, Wendy.
Oh, no, you continue, Linda.
No, so that patient would never have fit what a physician would have thought in an addicted patient or an addict profile.
Yeah, I mean, we don't think about, I've been writing about the senior market in this country for 20 years. It's called Boomers and Beyond, a lot of what I do. And I know, I forget the exact number because I start losing track of numbers, but it's something like the average adult 65 and older is automatically already on 5 medicines a day, something like that, between their blood pressure, their cholesterol, very often nowadays with diabetes, and whatever else. And so it's bad enough if you're just on the one opioid, God help you, but you start mixing it in, and if your patient is, my daddy was the generation, you do not question the doctor. So the doctor hands you something, and you say, oh, okay, fine, and the doctor doesn't know anything's gone wrong. It's a very, very dangerous issue with seniors on top of everybody else.
You have to understand something. The physicians in the 90s were told to manage pain. CMS made pain the 5th vital sign. Hospitals and the medical community was told you had to alleviate pain. These painkillers were non-addictive. So it was easier to write a 30-day script and send the patient out with that script than have them come back every 7 days for a new script if they needed it. And patients, as you said, well, my doctor gave me this. I have to take it.
Right.
And once pain has been alleviated, it's far easier to become addicted to the opioids. So the length of those prescriptions contributed to it.
Well, the funny thing is, one of my favorite shows is the very old show Golden Girls, which goes back something like 30 years. And they did some amazing shows. And one of them was where the Betty White character, Rose, girls find out by accident that Rose has been taking a painkiller for something like 30 years. She hurt herself as a teenager on the farm, and the doctor prescribed it, and back in that day, they just kept automatically refilling it. And one day, her drugs got dropped accidentally, and she says, oh, don't worry, it's no problem. And they show her the next day screaming, yelling, losing her temper until she gets her prescription back. And then she's nice and calm, and no, I'm not addicted. And so this is 30 years ago. And that it's taken us this long to even talk about it. But anyway, let us get to the tech side before we both just stick to the opioid crisis. So I started, as I mentioned early, on July 1st, the prescribers in Maryland are going to have to do certain things. They're going to have to check the RX program, the monitoring database. So one of the things I heard about from DrFirst was to talk about the need for easy access to PDMPs. And the average person, even if there are doctors, and we have doctors and all sorts of experts listening, but what the devil, explain to them again, PDMPs.
PDMP is the Prescription Data Monitoring System for the states. It has any controlled substance prescriptions that have been written are in this database. But this database was originally written for law enforcement, not for health care.
Oh, that's interesting. And so do most hospitals have it yet? And even if the hospitals have it, I've been writing about health information technology for something like almost 20 years, whenever Y2K was. Well, yeah, almost 20 years. Good Lord. So do the hospitals have this database, and are they connecting with each other so Sinai can tell the VA, or who can tell, pick a hospital, St. Agnes, any hospital? You know, how can they interconnect?
All right. Some states have it where you must go through the state portal, and it's a web address that each physician or prescriber registers with to access that information, such as New York. In New York, it was called iStop. However, when you're expecting a prescriber who has a limited number of time with the patient to go to an external database, enter the patient information, and get the PDMP information back, it's not happening.
Right.
So the state of Maryland actually partnered with CRISP, which is the state HIE, to have the PDMP accessible through CRISP. And then CRISP and MedChi, which is the state's medical association, took it a step further and partnered with DrFirst to give to the physicians and prescribers electronic prescribing tools, which puts the PDMP access right within that application and can be done at the same time you're writing the script within the same application.
So is this like putting it on an iPad, and as the doctor's writing his RX on a form in the iPad, it will automatically go to the organizing section?
It's not a form. They would have to be using an electronic prescription system, which is ours is iPrescribe, which is our mobile app. And when the physician would put my name in as a patient, they would just click the PDMP button if they were planning on writing a controlled substance, and it would return all the information real time. And the prescriber gets credit for having checked the state PDMP.
Now, does this just apply to regular doctors, MDs, or if I'm a social worker who's counseling a patient? Because I know we have such a lack of psychiatrists and even psychologists that a lot of times the work is going to social workers. I know a wonderful social worker who does this kind of thing over at Kaiser here in the Woodlawn area of Baltimore. So would a social worker be able to access this, or they got to have fancy initials after? Well, social workers have some initials, but still, you know what I mean.
It would have to be designated as an agent of a physician or somebody with an NPI and a DEA number.
Okay. All right, I know the DEA is the Drug Enforcement Administration. You start getting crazed with all the initials and the acronyms and so forth. They can get you bonkers trying to remember who doing what with whom and so forth. Anyway, okay.
My whole life is acronyms.
I can imagine. So when we say value